Hi friends, welcome to the channel The Nurse. Here we are discussing about most repeated nursing questions for upcoming exams, nursing tutor, ESIC, BARC Nurse A exams. So these questions will be helpful for preparing these exams. So if you are not subscribed to our channel, please subscribe. We will discuss most repeated nursing questions in this video. Most repeated nursing questions 2022. First question. The nurse is ready to begin an exam on a 9-month-old infant. The child is sitting in his mother's lap. Which should the nurse do first? Check the Babinski reflex, listen to the heart and lung sound, palpate the abdomen, check tympanic membranes. Correct answer, listen to the heart and lung sound. If the nurse is doing any other mentioned procedure, means the baby will start crying. So listening the heart and lung sound will be very difficult. So that is why it is told to do listening heart and lung sounds at first. Then you can do the palpate, or you can check a tympanic membrane, or you can assess the Babinski reflex, etc. The first action that the nurse should take when beginning to examine the infant is to listen to the heart and lung sounds. If the nurse elicits the Babinski reflex or palpates the abdomen or looks in the child's ear first, the child will begin to cry, and it will be difficult to obtain an objective finding while listening to the heart and lungs. So that is why it is told to do the auscultating heart and lung sounds first before doing any other procedures, Babinski or palpate the abdomen, or checking the tympanic membrane, etc. Next question. In terms of cognitive development, a 2-year-old would be expected to think abstractly, use magical thinking, understand conservation of matter, see things from perspective of others. Important thing, this is 2-year-old child. Here correct answer is the 2-year-old child will do use magical thinking and other things, think abstractly, understand conservation of matter, see things from the perspectives of others, etc. are older children or adolescents thinking cognitive development. But in early childhood, the magical thinking will be very we can see in a 2-year-old child. A 2-year-old is expected to only use magical thinking, such as believing that a toy bear is a real bear. That is called magical thinking. So same time, answer A, C, D are not expected to until the child is much older. So other options are for older children, and magical thinking usually seen in younger child, that is the children around 2 years or 2-3 years. The magical thinking will be there. Abstract thinking, conservation of matter, and the ability to look at things from others' perspective are not the skills of small children. So while getting maturity, this kind of cognitive behavior will be there. But in younger children, there will be magical thinking. That is the main cognitive behavior. Third question. A client who has been receiving urokinase has a large bloody bowel movements. Which action would be best for the nurse to take immediately? Administer vitamin K IM, stop the urokinase, reduce the urokinase and administer heparin, stop the urokinase and call the doctor. So if you know the action of urokinase, you can answer the question easily. Urokinase mainly giving for as a antithrombolic. So if it is giving, we need to watch for bleeding. So in this question, the patient has a large bloody bowel movement, that is blood in the stool. So large blood clots are there in stool. So in that condition, there may be internal bleeding. So that is because of administration of urokinase. So in that situation, what we can do, we can stop the urokinase and call the doctor. In first action, administer vitamin K because vitamin K there is no action regarding it is not an antidote of urokinase. So there is no point in administering vitamin K and stop the urokinase. That is a part of an action, but only stopping of urokinase will not be effective. So we need to inform the doctor also. So that is why the fourth option is correct. So best option will be fourth option. In question, it is asked the best for the nurse to take immediately. So fourth option will be the correct one. And the third option, reduce the urokinase and administer heparin, will not give any proper action because administer heparin also an anticoagulant. So it will again deteriorate the bleeding. Urokinase is a thrombolytic used to destroy a clot following a myocardial infarction. So usually the myocardial infarction due to thrombi. So in that condition, we will administer urokinase as a thrombolytic therapy. So in that condition, the bleeding we should observe. The more likelihood complication of urokinase or any other thrombolytic therapy is a bleeding. So we need to observe for bleeding. So as an GI internal bleed will demonstrate as the blood will be in the stools. So if the client exhibits overt signs of bleeding, the nurse should stop the medication, call the doctor immediately and prepare the antidote. So what is the antidote of urokinase? That is Amicar. That trade name is Amicar. The pharmacological name of the urokinase antidote is aminocaproic acid. So that is the antidote for urokinase or any overdose of urokinase or any bleeding related urokinase. We can treat with aminocaproic acid or we will get a Amicar trade name medicines. Fourth question, the client has a prescription for a calcium carbonate compound to neutralize stomach acid. The nurse should assess the client for. So calcium carbonate widely used for like a antacid to neutralize the stomach acid in acidity condition. So in that condition, what is the most expected complication with the calcium carbonate compounds? Constipation, hyperphosphatemia, hypomagnesemia, diarrhea. The correct answer is constipation. Constipation is the most common complication related to calcium carbonate compounds. The client taking calcium preparations will frequently develop constipation. So we need to observe the constipation. If the patient is taking any calcium preparations, there is a chance for constipation. Fifth question, the nurse is caring for a client with peripheral vascular disease. That to correctly assess the oxygen saturation level, the monitor may be placed on the hip, ankle, earlobe, chin. So here important point is patient is having peripheral vascular disease. Correct answer is earlobe. In all other conditions, if the peripheral vascular disease is there, means there will be getting a wrong report of oxygen saturation. So best area is earlobe. Otherwise, if the patient is child, means that some probe is there that we can attach on the forehead. So that two method we can use. So in this option we have only earlobe options. So we can use the earlobe area to assess the oxygen saturation. If the finger cannot be used, the next best place to apply the oxygen monitor is the earlobe. The choice in answer A, B, D will not be provide the needle readings. So hip and all, ankle, hip, etc. are not best area to assess the oxygen saturation in the case of especially peripheral vascular disease. Sixth question, the doctor has ordered antithrombolic stockings to be applied to the legs of the patient with the peripheral vascular disease. the nurse knows antithrombolic stockings should be applied? So this question also related with the peripheral vascular disease. So in this question, the best time to apply antithrombolic stockings: before rising in the morning, with the client in a standing position, after bathing and applying powder, before retiring in the evening. So here correct answer is before rising in the morning. So while before waking up from the bed, we need to apply the antithrombolic stockings. So we will see why it is. The best time to apply antithrombolytic stockings is the morning before rising, before waking up. If the doctor orders them later in the day, if doctor is ordering after the rounds or after later in the morning, then the patient has to advise to stay on the bed for 30 minutes, then only apply the stockings. Answer B, C, D are incorrect because there is likely to be more peripheral edema if the client is standing or has just taken a bath before retiring in the evening is wrong, because the late in the evening more peripheral edema will be present. So why the stocking is applying means to reduce the peripheral edema. So in the case of later in the evening or after the bath or after standing position etc. will cause the peripheral edema. So after causing peripheral edema, it is difficulty to bring back the blood, venous blood. So before applying, before rising up, before waking up from the bed, if it is applying means it will be very beneficial for the patient. Seventh question. A client with a femoral popliteal bypass graft is assigned to a semi-private room. The most suitable roommate for this client is the client with hypothyroidism, diabetic ulcers, ulcerative colitis, pneumonia. So this is a post-surgical patient. So in with this patient, which of the patient having the given options disease condition can be accommodated? So patients with hypothyroidism, diabetic ulcers, ulcerative colitis, or patient with pneumonia, which patient is best to accommodate with the post-operative patient? So here correct answer is hypothyroidism. Hypothyroidism is a non-infectious condition. So there is no chance for communicating or spreading infection to the post-operative patient. All other conditions, diabetic ulcer, that is also an infective condition. Ulcerative colitis also an infective condition. Pneumonia also. So all other three conditions, the patient may have, there is a chance to get infection from this patient. So post-operative is non-infectious patient to be accommodated with that patient. The best roommate for the post-surgical client is a client with hypothyroidism, because hypothyroidism will not spread. The client is sleepy and has no infectious process, because due to the hypothyroidism, the patient may be always feel sleepy. So it is not an infectious disease, so there is no risk for communicating infection. But in option B, C, D are incorrect because the client with a diabetic ulcer, ulcerative colitis or pneumonia can transmit infection to the post-surgical client. So that is why these patients are avoided. Eighth question. The client returns to the recovery room following repair of an abdominal aneurysm. Which finding would require further investigation? Pedal pulses regular, urinary output 20 milliliter in the past hour, blood pressure 108/50, oxygen saturation is 97%. So patient is undergone a surgery for abdominal aneurysm. In one of the option, that is an abnormal finding for this patient. So first you need to find out which one is abnormal finding. So here correct answer is urinary output 20 ml in the past hours, because normal urine output will be 30 ml or more in a normal conditions. So 20 ml means it is a oliguria. So that is maybe indicating either internal bleeding or hypovolemia. So this finding require further investigation. So the doctor or nurse has to find out the reason for oliguria or decreased urine output. It may be due to hypovolemia, or patient may going to shock, or in some other condition there will be a intraoperative bleeding or internal bleeding. There is a chance. So the further investigation is needed in the case of urinary output 20 ml in the past hour. If it is more than 30 ml means it is a normal findings. There is no further investigation is needed. But in this option, it is given 20 ml per hour. And pedal pulses are regular. That is a normal finding. So there is no investigation or further intervention is needed. Blood pressure is 108 by 50. That is a less, slightly lower side only, but still in the postoperative case of abdominal aneurysm, there will be lower side only BP is required. Otherwise, there is a bleeding chance is there. So doctor also will keep the blood pressure little lower. Oxygen saturation 97% is also, it is a normal finding. So in all other three conditions, there is no further investigation needed. Only urinary output 20 ml in the past hour, that is a abnormal finding. So required to find out the reason. Because the aorta is clamped during surgery, the blood supply to the kidney is impaired. This can be result in renal damage. A urinary output is 20 ml is oliguria. So what is a normal urinary output per hour? That is 30 ml per hour. Less than 30 ml, that will leads to oliguria. In answer A, pedal pulses that are thready and regular are within normal limits. For answer C, that is desirable for the client's blood pressure to be slightly low after surgical repair of an aneurysm. Oxygen saturation of 97 in the option D within normal limits, and therefore no further investigation needed. So other options are incorrect. Then ninth question, the nurse is caring for the client following cerebral vascular accident or CVA. Which portion of the brain is responsible for taste, smell and hearing? Occipital, frontal, temporal, parietal. So which cerebral part of the brain is controlling taste, smell and hearing? Correct answer is temporal lobe. Temporal of the cerebrum is controlling mainly taste, smell and hearing. So we will see what are the functions of other lobes also. Temporal lobe is responsible for taste, smell and hearing, that we already mentioned in this question. So the occipital lobe, that is mainly responsible for vision. Occipital lobe of the cerebrum, that is mainly responsible for vision. Then at the same time, frontal lobe, that is responsible for judgment, foresight and behavior. So our behavior, judgment, ability, etc. are responsible for frontal lobe. In the alcoholism and all, mainly affecting the judgment ability of the patient. So that is mainly affecting the frontal lobe. Then parietal lobe. Parietal lobe is responsible for ideation, sensory functions, language, etc. are controlled by parietal lobe. So mainly taste, smell and hearing, it is controlled by temporal lobe, that is asked in question. 10th question. The nurse is taking the blood pressure of the obese client. If the blood pressure cuff is too small, the result will be a false elevation, a false low reading, a blood pressure reading that is correct, a subnormal finding. Correct answer, a false elevation. If the blood pressure cuff is too small means we will get a false elevation for false high BP. If the cuff is very big and the patient is small, then we will get a false low reading. So that is a difference. If the cuff is small and patient is big means, so we will get a false elevation or increased BP, false increased BP, or cuff is large and patient hand is very small, then we will get a false low reading. If the blood pressure cuff is too small, the result will be a blood pressure that is a false elevation. Answer B, C and D are incorrect. If the blood pressure curve is too large, a false low will result. So that is what I told. 11th question. A 4-year-old male is admitted to the unit with nephrotic syndrome. He is extremely edematous. To decrease the discomfort associated with scrotal edema, the nurse should apply ice to the scrotum, elevate the scrotum on a small pillow, apply heat to the abdominal area, administer an analgesic. Correct answer is elevate the scrotum on a small pillow. So that will help to drain the fluids. So like that we can reduce the discomfort due to the scrotal edema. So we will see the explanation. The child with nephrotic syndrome will exhibit extreme edema. That is because of loss of albumin. The body edema is due to loss of albumin. That is the main cause of edema in nephrotic syndrome. Elevating the scrotum on a small pillow will help the edema to drain out the to increase the venous drainage. Applying ice, that is contraindicated, so it will make a vasoconstriction. So the venous drainage will reduce. If we are applying ice, means venous drainage will reduce, so it is contraindicated. Heat will increase the edema. So heat will increase the edema. How it is? Because more blood will come into the area, then it will increase the edema. Administering a diuretic might be ordered, but it will not directly help the scrotal edema. Why? Because diuretic will reduce the whole body edema. It will not directly affect the scrotal edema. So it will take a time. So best method is elevating the scrotum with a small pillow. 12th question. The doctor is preparing to remove chest tubes from the client's left chest. In preparation for the removal of the nurse should instruct the client to. In preparation for the removal, the nurse should instruct the client to breathe normally, hold his breath and bear down, take a deep breath, sneeze on command. So the doctor is planning to remove the left intercostal drainage. So that time, what instruction should the nurse given to client? Correct answer is hold his breath and bear down. So holding breath and bearing down process will increase the intrathoracic pressure. So if intrathoracic pressure is higher than the outside atmospheric pressure, the air will not enter into the thoracic cavity while removing. So that is why the nurse should advise the patient to hold his breath and bear down process. So it will help to avoid the entry of air into the thoracic cavity, because intrathoracic cavity will be higher than the atmospheric pressure. So the surgeon can easily apply the plaster and make it airtight after removing the tube. The client should be asked to perform a Valsalva maneuver while the chest tube is being removed. Valsalva maneuver means that is for defecation, and defecation we are doing Valsalva maneuver. So how it is, the physiology means it will increase the thoracic and intra-abdominal pressure. While doing Valsalva maneuver, our intrathoracic and intra-abdominal pressure will increase. So during that time, the surgeon will remove the ICD tube. Then the atmospheric pressure will not enter into the thoracic cavity, because intrathoracic pressure is very high. The lower air pressure will not enter into higher air pressure. Then it will prevent the changes in the pressure until an occlusive dressing can be applied. So surgeon will remove the ICD tube and will apply a airtight dressing. 13th question. The doctor has ordered 80 milligram of furosemide, that is Lasix, 2 times per day. The nurse notes that the patient's potassium level is to be 2.5 milliequivalent per liter. The nurse should administer the Lasix as ordered, administer half the dose, offer the patient a potassium-rich food, withhold the drug, and call the doctor. So first you need to understand what is the side effect of furosemide or Lasix medicines. So then you can answer here, and also you need to understand the normal level of potassium level. So one of the main complication of Lasix or furosemide medicine, that is hypokalemia. In this question, the patient is already having hypokalemia, that is the potassium level is 2.5 milliequivalent per liter. Normal potassium level is 3.5 to 4.5 or 5. So here the patient's potassium level is 2.5 milliequivalent per liter. The patient is already suffering hypokalemia. If the nurse is administering again the Lasix, it will deteriorate the patient potassium level. It will further reduce the potassium level. And what will cause the decreased potassium level means that will leads to arrhythmia. So that is why the nurse should take care the potassium level while administering a furosemide. So here correct answer is option D, that is withhold the drug and call the doctor. So administer the Lasix as ordered. We cannot administer if potassium is low, already low. It will deteriorate the condition. Administer half the dose. That also we cannot do because we cannot change the doctor's order. And offer the patients a potassium rich food. That will take a time and it will not cure the current condition immediately. So best measure is withhold the dose of drug and we can inform the doctor. The potassium level of 2.5 milliequivalent is extremely low. The normal, that is 3.5 to 5.5 milliequivalent per liter. Lasix is a non-potassium sparing diuretic. So answer A is incorrect. Because in already hypokalemic patient, we cannot administer the Lasix. So what is the example of potassium sparing diuretic? You can comment it in below. And so Lasix is not a potassium sparing diuretic. So we cannot administer Lasix if there is already hypokalemia. The nurse cannot alter the doctor's order. That means half of the dose also the nurse cannot administer without doctor's order. Then other options also incorrect. 14th question. Which of the following lab studies should be done periodically if the client is taking warfarin sodium? Warfarin sodium, the trade name that medicine is Comadin. Options they are stool specimen for occult blood, white blood cell count, blood glucose, erythrocyte count. Correct answer is stool specimen for occult blood. Warfarin is an example of oral anticoagulant. So while administering warfarin, in previous question we have discussed about urokinase, that is an injectable antithrombolytic. Then warfarin is oral type of anticoagulant. So while administering warfarin, we need to see the stool specimen for occult blood because there is a chance for internal GI bleeding, gastrointestinal bleeding. So we can find out by doing stool specimen for occult blood regularly. White blood cells usually doing any medicine that causing this leukopenia, that is decreased blood cell white blood cells count. So blood glucose level we are usually monitoring along with this steroid while giving steroid medication and all, or oral hypoglycemic agents, etc. while administering, we need to monitor blood glucose level. Erythrocyte count, we need to monitor with the chemotherapy medicines, so that may or any other medicines that that will cause the bone marrow suppression. So that time we need to count the erythrocyte count, etc. So these are the thing. So while administering warfarin sodium, we need to observe for stool specimen for occult blood, or we need to observe the bleeding. Any other type of bleeding also we need to see. If there is no external bleeding, we need to do the occult blood study regularly to assess the any other chance of internal or GI tract bleeding. An occult blood study should be done periodically to detect any intestinal bleeding on the client with Coumadin or warfarin therapy. Last question. The client has an order for heparin to prevent post-surgical thrombi. Immediately following a heparin injection, the nurse should aspirate for blood, check the pulse rate, massage the site, check the site for bleeding. So the patient is a post-surgical thrombi, that is to remove the post-surgical thrombi. Prophylactically, doctor will administer heparin. So after administering heparin, low molecular heparin, sometimes will advise, or sometimes heparin itself will advise. So after the administration of heparin, what we need to do? So correct answer, check the site for bleeding. So heparin also antithrombolytic or anticoagulant. So we need to check the site for any bleeding. So that is a very important thing after administering heparin. After administering any subcutaneous anticoagulant, the nurse should check the site for bleeding. Answer A and C are incorrect because aspirating and massaging the site are not done after heparin injection, or after giving any anticoagulants. We should not massage the area. Checking the pulse is not necessary as an answer B. So option B, it is given checking pulse. That is also not necessary after administering heparin. As a routine, you can do you can check the vital signs. That is no issue. But after giving heparin, there is no specifically need to check the pulse. So that is about today's video. So we have discussed 15 questions today. So if you have any doubt, means you can ask in comment section. I will try to solve your doubts, and best wishes. And if you like this video, means please press the like button and share with your friends. So thank you. Bye bye.